Artificial disc replacement in the cervical spine or the neck is an operation that should be considered for a person who has neck pain and arm pain from a herniated disc, or another condition called spinal stenosis, where their bone spurs have developed and the patient has pain again in the neck and the arm. These are patients that in the past we've considered doing a spinal fusion. The problem with fusion is it stops the motion, and with the stopping of the motion, the neck still tries to bend and people still try to move, and when they do that, they're going to increase the stress on the adjacent disc. And that disc will move even greater than normal. That increased motion will lead to wear and tear. And that wear and tear, in some cases, will lead to the need for more surgery. Well, in a traditional open cervical fusion, we have to put a plate or screws or something to hold that still. And what that means is we cannot encourage the patient to move their neck. We actually want them to not move their neck. And it's going to take that bone healing 3 months, sometimes up to 6 months to heal. We want to preserve the motion in an artificial disc. And in many patients, what we see is their motion improves. And it improves because we've stopped the pain and we've replaced the joint. It's really no different than replacing your hip or replacing your knee. Patients hurt before knee replacements, and when they have the replacement, what do? They encourage them to move, to walk, and bend. And it's the same thing for your neck. We want to encourage them to bend their neck and move their neck, and really restore that neck to normal motion. It is the most commonly used implant in the United States. It's had the longest clinical trials to date in the world. And for this reason, because it's been tested and used in thousands of patients, we feel comfortable with it. It allows this motion to take place, and it has the right amount of physiological motion, which is side-to-side bending, rotation, and then forward bending and bending backwards. Cervical disc replacements can be done really in the outpatient setting. They don't really need to be done in hospitals. Most patients are able to leave the outpatient setting either the same day or the following day. We actually have them placed in a soft collar for a few days, and we begin moving their neck 2 days after the operation. And their recovery is about 90% complete in 2 to 3 weeks.